Hello, I'm Dr. Suess from Clackamas Smiles. We get a lot of questions about tooth whitening. Basically, every patient that comes in wants to know something about how to get a whiter or brighter or straighter smile. So I'm here to answer some of those questions today. Tooth whitening is anything that you can do to make the appearance of your teeth lighter in color. As years go by, stain can build up, teeth can get darker, and really just the passage of time itself can make them a little bit darker, a little bit dingier than they used to be. And that's why we hear so often people asking, how do I improve the look of my teeth? How do I get that whiteness that I remember? Or they'll see other people with white teeth and say, I'd like that. How do I get that for me? One of the biggest misconceptions that I run across every day is people think, well, whitening must be bad for my teeth. It must hurt the surface. And really, that's only true with one kind of whitening. If you use the kind of whitening that scrubs the surface of the tooth, it uses heavily abrasive particles, you can do some damage to your teeth. But the kind of whitening that's actually better for you is the kind that chemically whitens your teeth. It doesn't use abrasives like miniature sandpaper. It uses the chemistry to help decrease the compounds in your teeth that look dark, look dingy, or look yellow, and it breaks those down so that they are eliminated from the tooth surface, and then the white, bright, natural part of your tooth can shine through. How do dentists whiten teeth? Well, that's a closely guarded secret. We'd never tell. No, the reality is we have a lot of different processes that we could go through, but most of the chemistry is really simple. It involves a bleach, not the same kind of bleach that you'd use for your laundry, but a kind of bleach that's much more similar to hydrogen peroxide. It's not simple hydrogen peroxide. It's specially formulated so it's safe for our teeth and safe for our gums, but nonetheless, it's the kind of compound that is comfortable for the teeth, safe to have on long term, but also really effective at getting rid of the yellow and the dingy and the dark portions of the stain so that the natural beauty and lightness of your tooth can shine through. Here's one more secret that a lot of people don't know is among dentists and in dentistry, we kind of make fun of the LED lights. You'll see them on Instagram, you'll see them online, you'll see them even advertised on TV, and they have this little glow ring and it goes in your mouth and it looks like it's glowing blue or red or whatever the color of the day is. The reality is that doesn't do anything. It looks cool, it sells a lot of product, but it's not actually helping your teeth get lighter. The gel, the chemistry, the actual product that you put on your teeth, it's doing all of the work. And so with or without that light, it still works equally well. So if you're looking at two different styles of whitening and one has a light, don't automatically think that works better. We haven't found that to be the case. Let's talk about teeth whitening at home. When you order something online, you don't necessarily know where it came from. You don't necessarily know the concentration. You don't know how it was kept or how it was stored. And as time goes by, the bleaching material itself, it wears out and it breaks down. So if you have old material or material that wasn't stored properly, you're not going to get the full effect of that material. So it really does matter how high of a quality of bleaching that you get. Now, if you have something from your dentist's office, something that's been refrigerated, something that's been stored correctly, it's much more likely that that's going to work well, work the way we expect it to, and you're not going to have any complications. One of the worst things I could imagine is if they put a material that's too strong and it could cause harm to the skin or the gums around your teeth. Those things are also possible, and we've seen case reports of those as well. So buyer beware when it comes to bleaching. And if you're getting something online and it's not a trustworthy company, you don't necessarily know what you're going to get batch to batch or box to box. Sometimes the question is, well, I don't want to keep whitening my teeth. What can I do to whiten my teeth permanently? And if that's your question, I think the answer would be, yes, we can. We can put something over the surface of your teeth. And we've had patients ask, they say, well, my bleaching is going good, but it wears off from time to time. And I have to bleach again. And we're like, yeah, that's normal. You can bleach again and again and again. And really, if you have custom-made trays, it makes that really easy and straightforward. You get more bleach, you put it in your tray, you pop the tray in, and you do a touch-up every once in a while. That works for most people. But if that's not going to work for you, you can consider doing something like crowns or veneers. And that's a more permanent covering on the outside portion of the tooth that doesn't discolor. That way you can achieve a new shade and keep that shade for the long term without the nuisance or aggravation of going back and bleaching time and time again. So yes, there is a way for your bleaching to last forever, but it's by covering the surface of the tooth with something that doesn't darken. Let's talk about teeth whitening side effects. One of the most common ones is sensitivity, really cold sensitivity. If you do some consistent whitening day after day after day and you get anywhere near an ice cream cone, it's going to feel really uncomfortable. I've had patients tell me even doing that or going outside on a cool morning, they can say, gosh, my teeth sort of hurt and they feel sensitive. That part's true. Expect that. If you're bleaching, your teeth will likely become sensitive. And I think that's where the misconception comes from of people thinking bleaching's causing damage. That's not true. Bleaching doesn't cause damage to the surface of the tooth, but it does cause sensitivity. So be prepared for that. And just know if I'm bleaching, beauty is pain. It's going to cause you some sensitivity. But rest assured that sensitivity is temporary. Your teeth will go back to the way that you remember them. They'll keep the whiteness, but you'll get rid of the discomfort. That's when you really get to enjoy your new white, bright smile. So does whitening cause sensitivity? 100%. There's things that we can do to minimize it. You can use desensitizing toothpastes. You can control the time or how you apply the bleaching material. We go through each of those steps with each patient when they start bleaching. But what you can expect is when you use bleaching, when your teeth start getting lighter, you're going to notice an increase in your cold sensitivity with only very rare exceptions. So do expect it to be sensitive. That sensitivity will be temporary, but the results will be worth it. Once you've whitened your teeth, you're going to want to maintain that whiteness. And one of the best ways you can do that is twofold. First, watch what you're eating and drinking. You don't want to eat anything that's too dark or too colored, especially in the short term after whitening. The second is going to be to really follow up and do the touch-up whitenings that you can do from time to time. If you're using strips, it might require buying or getting more strips to put on your teeth. If you're using the kind of bleaching that is in a tray and you have a gel that you can insert that, once you've done the majority of your whitening, take a break. See how that whitening stabilizes out. See what shade that you really become. And then as time goes by, if you notice those teeth getting a little darker, a little more yellow, take out those bleach trays again, fill them back up. You'll find that your touch-up goes much more quickly to get back to that nice light shade. So yes, touch-up is the key. When you're thinking about when to do teeth whitening, it can be with your regular appointment. It can be its own appointment. You could just give us a call and say, hey, I'm really interested in doing some teeth whitening. From time to time, we even have promotions where new patients might be eligible for some teeth whitening discounts. Give our front office a call. Let us know that that's your concern. That's what you want us to address. We're happy to go over it with you. This is a conversation that's fun to have because it leads to, a better, healthier, happier smile and really satisfied patients. I hope I've been able to answer any of your questions about bleaching and maybe shed some light on the subject. If you or anyone in your family has questions about bleaching, or if you're just ready to get started, there's no better way than to call us. Skip the confusion and the uncertainty of going with an online product. Come on in. Let us tailor-make a solution for you, something that's going to be right for your teeth, and do it in a way where we can monitor those results, make sure that you get as white as possible for you while minimizing or skipping at least some of the sensitivity. Our number here, 503-786-3000.